come. And by the way, we appreciate very much our relationship and work with the CDC. They've been an enormous help in all of this, and they've been a great partner for them. We rely on them greatly, and we hope you will tell them that for us. I wanted to ask, you'd mentioned the temperature and the indoors and outdoors and where the virus likes to spread. And we know that here in our state, the weather has been beautiful, so the air conditioners have not been on, but neither have the heaters. So there hasn't been a ventilation question. A lot of us are outside and windows open inside. We believed earlier that when the warm weather got here that the virus didn't like the warm weather and that it may dissipate. And people went to the beach, but then we had a spike, and we thought, well, maybe that's because they all went inside and were in the air conditioning and were grouped up together. Can you give us any insight into that and what's going to happen when winter gets here?
Question. And I know many of us had hoped that, like many respiratory pathogens, when we get into warmer weather, historically, they would become less problematic. And that is because, and COVID's a great example, it doesn't like the UV light as it comes in from the summer angle. And UV light can inactivate it. It doesn't like warmth, hotness over coldness. But what it really doesn't like for human-to-human transmission is it doesn't like humidity. Because the way the virus predominantly transmits in droplets. And when those droplets are hit with humidity, they help the droplets drop to the floor and negatively impact its transmission. But as the governor said, a lot of that understanding was understood independent of this other variable, which is called ventilation and air conditioning. So we believe, and Dr. Birx and I believe, that much of the southern surge was caused by individuals coming south for vacation and not being, full-time Southerners found the hot afternoons more acceptable when they went into air conditioning. So I do think that's what drove it. This virus doesn't like a lot of ventilation, and we really asked for it. The reason that we think we're seeing, the surge that we're seeing now, it's not a surge that we had hoped was just a small surge post Labor Day, but clearly we're in an expanding phase. We had, I think, over 62,000 cases. Is that right? 62,000 cases? Right around 60,000 cases today. And we have now 68% of the jurisdictions in the upward trajectory. We think a lot of that is also driven by individuals in the north now going inside for warm weather, less ventilation. So we're having significant transmission now in Idaho, Montana, Wyoming, North Dakota, Wisconsin, Minnesota. A lot of that you wouldn't think about, Nebraska, and then coming across the Midwest. So weather has a role, but weather's not going to protect us. What is going to protect us, and the governor said this clearly at the beginning, we are not defenseless against this virus. We have a powerful weapon. It's called a face mask. And that face mask, if all of us wore it for 4, 6, 8, 10, 12 weeks, we would begin to really contain and control this pandemic if we coupled that with the wisdom about hand washing, the wisdom about avoiding crowds, the wisdom about smart decisions about certain environments that may not be in the best interest of containing this virus, and that's why one has to think it through. And of course, I really plead with people to take advantage of vaccinating with the flu vaccine with confidence. Not that that's going to prevent coronavirus, but that may keep people from having to be hospitalized from influenza, which many of you may not focus on, but we can have 60,000, 70,000 people dying a year from influenza. We've had, when I came in and I looked at the 10 years prior to my directorship, 360,000 people died of flu in 10 years. So I want to prevent those sick people from flu from going into hospitals so that those hospital beds are available for the people that do get sick with COVID. And now we can treat them. It's really remarkable that in the last 6 months we've improved. If you looked at April, May, March, if you were 70 years old, you had a 25 to 30% chance of dying if you got COVID, and today it's probably somewhere between 3 and 5%. That's a huge improvement. But that means we want those beds available for people to go into the hospital to benefit from the advances of therapy that we've had.
Thank you.
Thank you, Dr. Redfield, Governor McMaster, all of our fellow state agencies and partners for being here today. Discussions like these ones that we've been engaged in are, despite the rapid advances about what we know about COVID-19, this disease continues to present short and long-term challenges for public health officials and other leaders at the local, state, and national levels. This includes the indirect health effects of COVID-19 on our state and people in the country, including the health effects on chronic conditions, substance use, and mental health. DHEC's remaining committed to engaging with our federal, state, and local partners to stay up to date on the latest information and data from here at home, as well as other places in the country and in the world. As we enter cold weather and flu virus season, we anticipate that we may see increases in COVID-19 cases, just like, as Dr. Redfield said, we're seeing in other parts of the nation. Our focus is on taking action now to alleviate any potential surges we may see in future case numbers. This means continuing to avoid large group gatherings, particularly indoors, practicing social distancing, washing your hands, and especially wearing a mask. With that, I'm going to give it to Dr. Linda Bell, our state epidemiologist.
Yes, thank you, Dr. Traxler. And I know that our time now is very short and your time is valuable. So I just want to take this opportunity, Dr. Redfield, to thank you very much again for this visit, for giving the opportunity for this audience, and to the rest of those who have joined us here to provide your insights. And just wanted to leave us with the comment that there is a great deal that we all can still do to take control over what we might see in the near future with the tools that we currently have in hand. But we've also brought to light that there are a number of other things that the COVID impact has had that brings to light the need to address the mental health and other impacts from COVID-19. So I want to thank you for drawing attention to that, and for all of you who have provided your contributions and for joining us today. Thank you.
Thank you.
Ms. Goldsby, do you have a couple of remarks to say?
Thank you, Dr. Traxler. Again, I just want to thank Dr. Redfield for being here today and for this engaging conversation on what we know are the secondary consequences or the collateral impacts of COVID-19. And we recognize that we've seen an increase in the alcohol and substance use in our citizens in South Carolina. And that may have long-term impact as substance use disorders are chronic, treatable diseases. And so we've been innovative in how we've taken new prevention and intervention steps on those diseases, and we have a long way to go, but we want, to give the public the message that help is available and hope is available. We say social isolation, but the key to this is staying connected in the safest way possible.
Thank you. Dr. Rogers?
Yeah, I just wanted to say I'm actually grateful to the CDC for actually highlighting mental health. It's not often that you see a physical health agency and one focused on disease that really highlights mental health and the impact that it will have on our society as we move forward through this pandemic. And so I'm just really, really grateful for that.
President Caslen?
Yeah, thank you, Dr. Traxler. Dr. Redfield, on behalf of the University of South Carolina and all the students and the faculty, we would like to welcome you to our campus, and thanks for taking the time to visit with us and coming out here to South Carolina and visit with us. I am proud to say that if I can give you an update on where the university is with COVID and our struggle with COVID, is that the best report I can give you is yesterday we tested 499 students and faculty and had 0 positives. So we are making great progress, and I give a lot of credit to the students and how well they've really taken this as seriously as they have. So we're proud to say that. We recognize in the midst of all this, and as you have reported, it's important for us to not be complacent and to remain vigilant. and to also prepare ourselves as we go home on Thanksgiving to make sure that we test all of our students and identify those that may be positive, that may be even asymptomatic positives, to make sure that we contain that virus back here and not bring it home to where they're going. Last, I would just say thanks for having the conversation on mental health. We recognize how tremendously important it is for COVID during this particular time. We address mental health very seriously. We survey every single week, and we are seeing numbers in the survey, for example, 20 to 25% will say that they are struggling with COVID here on the campus, both students and faculty. And it's something that we take very, very seriously. Sir, thanks so much for the visit. We appreciate it very much.
Thank you.
Thank you. Congressman Wilson, do you have a few remarks?
Yes, thank you very much. And Governor, Dr. Redfield, President Caslen, directors, it's been so inspiring to be here with you today because everything that has been said, it's really encapsulate what I feel, and that is that every level of government has been working together to protect the people of our state. I was this summer with President Caslen, and I was so impressed by his full report on what was going to be done to protect the students and the faculty here at the university, and he's done it. Thank you, Mr. President. And then on the federal level, I'm really grateful that we work together. My longtime friend and colleague, State Representative Jerry Govan, people working together on legislation. I was very pleased with President Trump on January 31. 10 days after the first case, there were only 5 cases, and he, I think, very courageously stopped travel with China. And then I'm very, very grateful that in the middle of March, in February, we saw his actions to turn to the private sector, not create new government agencies, but to go to drugstores, to grocery stores, to trucking companies, and not expand the level of government. And then the President's actions that evolve power to state and local governments. And we saw his efforts with ventilators, with hospital beds, with masks, in every way to assist. And then I had the opportunity to work with Governor McMaster and Secretary of State Mark Hammond. People have come together around the world. I was really grateful to work with the Republic of China, Taiwan, providing 100,000 masks, which, with the governor's assistance to Kim Stinson, the Director of Emergency Preparedness, for the people of South Carolina, with the Consul General from Atlanta and of Taiwan. So that I've seen it over and over again, positive. And then in regard to Congress itself, thank you for the recognition of the CARES Act. Initially, we were really doing good, bipartisan. Okay, we're in a political year. Things have somewhat deteriorated, but again, I'm really pleased that on Monday, we have Senator Mitch McConnell is going to be trying to bring back up again efforts to extend a program that has worked, the Paycheck Protection Program. Another example of success, the Small Business Administration, Greg White here in South Carolina. We've had remarkable successes, and I'm just honored to be a part of it and work with my colleague, Representative Govan.
Representative Govan?
Thank you very much for that, Congressman. First of all, Dr. Redfield, we want to commend you for the fine job that you've been doing as head of the CDC. We know it has not been easy, that there have been many challenges, and sometimes people have to put the health and needs of the nation ahead of politics. And we want to commend you as a public servant for having to make some of those tough calls and doing the right thing. As chair of the Legislative Black Caucus, I'm very proud of our state under the leadership of our governor, DHEC and others, Dr. Bell and the many folk around this table that have worked hard. We've been working with organizations such as the NAACP, the Action Network, as well as the Urban League and other 501c4s and 3s in terms of trying to get the word out in the minority community and actually of alarming or ringing the bell of how this pandemic has ravaged the minority community, not only in terms of minorities, but also in terms of our rural, poor areas. So the message I'd like to just leave with you as you make your way around this country is to don't forget about broadband, because all areas are not equal when it comes to access to health care. I shared a quick story with many of you here today, and I'll share it for the public. You know, I was at a funeral on Saturday and saw a colleague and friend, a fellow minister, drop dead after giving the eulogy. And come to find out, it is alleged that that individual was in recovery from COVID-19. So one of the things that I would like to leave you or emphasize for you to leave here with is the lingering effects of the virus and addressing those issues. So without proper health care and access to that health care, you know, what are the long-term effects, and emphasizing that to those that you come around, including the leadership in this present and even the future administration, whatever that may turn out to be. So I think it's important. Thank you so much for what you do for this country, and be safe.
I believe Representative Fry is on the phone. Do we have him up?
Hey, good afternoon. I'm joining you from the great metropolis of Myrtle Beach. It's quite a journey you being here, and I really appreciate your opening comments earlier about kind of keeping an eye on the opioid epidemic. I chaired the House Opioid Abuse Prevention Study Committee in South Carolina, where we've had tremendous strides of late, and certainly Director Goldsby is a rock star. We're so happy to have her, and certainly appreciate all the efforts on the federal side too, and hearing your personal story and just knowing how this has touched your life is important. Maybe this is more of a question too, to some extent, but Director, what do you see are things that states can do better during the pandemic to address the opioid epidemic? We've seen obviously states all across this country struggle with this in this last year, and are there any bright spots that you're seeing or things that states can do that really help keep an eye on mental health and substance abuse?
Thank you very much for your leadership in this space and your question. I think first and foremost, and it's not easy, I know it, I've watched it, I've lived it. I told you, I thought I understood substance abuse. I was an HIV hepatitis doctor in inner city Baltimore for over 20 years, where I had, probably over half of my patients had experienced heroin at some point in their life. So I ran a department of medicine where I had a division of addiction medicine in medicine. I thought I understood addiction until it entered my own family. And I realized I had no concept of what it really meant to effectively deal with addiction. And despite the fact that patients for decades were probably trying to teach me. And for me, the first thing, and it was with my own son, was when he came and told me that he was ashamed to bring this up to us. I asked him why he didn't come to us for help when he finally decided to surrender and go into treatment, and he said he was ashamed. And I told my son he should never be ashamed of who he is. He has a medical condition, a chronic relapsing medical condition, and we need to work together to get him treatment for it. So one thing we can do is create the climate that realizes that stigma is the enemy of public health. And we stigmatize people in very subtle ways. I was talking earlier about one of the subtle ways that we do even in the medical community, and this is not a criticism of my colleagues that spend their livelihood treating people, but I think the fact that we move addiction medicine away from primary medical care. Oh, you have addiction, you need to go see a psychiatrist. You need addiction, you need to go to this drug treatment center. For many people, that's stigmatizing. And we need to renormalize addiction treatment and for what it is, a chronic relapsing medical condition. We don't criticize people when their cancer relapses or when their angina and heart disease relapses. But when I've watched what happens to people that successfully get through drug treatment and go into remission and then relapse, I all too often see a sense of disappointment, a sense of how did that happen? You know, why did you let that happen? Rather than what it should be, that this is a chronic, relapsing medical condition. And we all pray, and I said my son's 5 years in recovery. I pray that he's in recovery the rest of his life. But he's got a chronic, relapsing medical condition. And I think so that's the first. And the second is the more that we can figure out how to reintegrate mental health services and drug treatment services into primary medical care, I think the further we're going to get along in making sure the citizens that you serve get the care and treatment that they need.
Thank you, Director. Thank you for all you're doing for this country.
Dr. Redfield, can you hear me okay? So tracking the number of COVID cases here in South Carolina since the pandemic began and the number of deaths, I'm curious about your thoughts on the state's handling of preventing the virus in the state, along with the tackling these long-term effects that we're speaking about right now, the overdose deaths, substance abuse, those kinds of issues.
Well, I think, truthfully, I'll be very honest, I think you're very fortunate for the leadership that you had. I think the governor said it very clearly, to look at how to put data into action to make the right public health decisions. You know, South Carolina is obviously was hit hard in the southern surge, and they really, I think, have put that into action. Secondly, I think you're really helpful with the university here, Dr. Caselin, and the innovation that university came up with testing. And to really develop really some innovative testing that have now been able to meet the university goals and really turn around, which I'm sure in the spring looked like a pretty tough challenge when you saw the extent of infection that was in the universities. I was very concerned that universities were going to be a real challenge, largely because of many of these young people not necessarily adhering to social distancing. I think it's really something you should think and write about or publicize, that within the last 4 months, it turns out that the universities now are the safest place in town. I mean, I think that the university here in South Carolina is probably looking at student infection rates now in the highest risk group that we have, 18 to 25-year-olds, are probably in the range of less than 2%. I know in the state of Wisconsin, I was talking to Governor Thompson, it's less than 2% in a state that has a prevalence rates of north of 10%. So I think those are real successes, and that people know that I think the university can be examples to the rest of the community. So the caution note that I've said, and I'll just say it now, is that the outbreak is on the increase now, and we got to be vigilant in recognizing the dynamics of transmission are different now than they were just 4 weeks ago. And this is why we have to really be vigilant about mask wearing, social distancing, smart about crowds, hand washing, and vaccination. On a positive note, I just want to iterate that I do think, and your state's preparing, I know I talked to your leadership today, that Friday the 16th, they're due to CDC their distribution plan for the vaccine at a micro distribution. That's not a fantasy. I think there will be vaccine to distribute before the first of the year, which I think is really nearly miraculous when you can think within 9 months we're going to have potentially 1 or 2 approved vaccines and something that normally takes 4 to 6 years. So I think those are it. Your issue on the chronic effects, I think it's important, as the congressman or as the representative brought out, that we don't know everything about this virus right now. I think the thing that shocked, I'm a clinician, I'm an internist, infectious disease. I think that the thing that we never expected, that this virus would cause your blood to clot, and all of a sudden when you cause clotting, that could have impact on your kidneys, it could have impact on your intestines, it could have impact on your brain. My brother lost a very close friend who got COVID, had no pneumonia, but he clotted off his major vessels in his brain and had strokes. So there's lots of things we don't know yet about this virus. So anyone that's too definitive that we know what we don't know, I'm going to be cautious. CDC is now doing, extensive studies to understand what we can learn about the post-resolution consequences. Can we understand them from a pathophysiologic perspective? But it's clear that because this virus uses a very particular receptor to attach. So like the flu virus, those receptors are in my respiratory tract. So we can control where the pathogenicity is. This virus uses a receptor which is in every organ of your body. And independent on how it interacts with those receptors and those cells may cause different disease consequences. So I'm not able to give you, data-driven science answer, and I've said this before, and I'm very proud of CDC. I'm very proud of the 23,000 men and women that work at CDC. Despite all the negative press that seems to be coming in this climate right now, I can tell you that these are the most outstanding men and women that protect this nation 24/7, and are really, most importantly, not just good scientists and good public health officials and good understanding data, they're great public servants. And I'm disheartened when I see the negative criticism, because some of them aren't used to it. Those of us that have been in these positions know that it comes with the territory, but I try to encourage them to keep their enthusiasm, to work 24/7 to protect the American public. But we are looking at this long-term consequence of COVID and try to get a better understanding of it.
And just a quick follow-up question. Are there any other recommendations you have here for South Carolina with this possible surge on the horizon, especially when we have so many big tourist spots like Myrtle Beach that people come to from all over the country?
Yeah, I think first is to be aware that the threat's still out there. Second is to really embrace that we're not defenseless. So the idea of making sure we educate people the importance of face coverings and not say it's no big deal. No, it's a big deal. I think the recognition of the importance of not having crowds and gatherings, particularly in indoor spaces, to really keep reinforcing that by example. I will say my greatest concern is no longer the public square, because every now and then if I start to walk out of, say, my car to go to the airport, and all of a sudden I see 7 people looking at me, I say, oh, boy, I don't have my mask on, and I put it on. I think the public square is there. Where I'm worried is the home gatherings. And we're looking at a big one coming up. And I think it's really important that we reemphasize that home gatherings with your brothers and sisters, your grandparents and everything, we always used to see that as the safe space. We're coming home, we're safe. I want people to really recognize they still have the responsibility to social distance. They do have the responsibility to wear face coverings, to hand wash, to be smart about crowds. I've talked to President Caslin about, the opportunities to lead universities in South Carolina to make sure the students that are now about to go home for Thanksgiving, and more than ever probably, because when I went to college, Thanksgiving was a 4-day weekend, and a lot of people didn't make the trip for 4 days. Now it's usually the end of face-to-face learning for most colleges, so they're going to be able to all go home. I do think it's important. And the same vigilance in the individuals that recognize what a great opportunity is in the cold of winter or the cold of late fall to come down to beautiful South Carolina, just to reemphasize how important it is for those face coverings. At the end of the day, what happens over the next 3 or 4 months is in the hands of the American public. And I've said this, some people don't agree with me, but I really think this is true, that if every one of us embraced face covering, social distancing, hand washing, crowd control, if we all did that, we would really control this pandemic. We wouldn't eliminate it, but we would bring it back under control within 6 to 12 weeks. And the problem is, with this virus, it's not going to work as half of us do this. Not even going to work as 3/4 of us do this. It's going to work if 95, 96, 97, 98, 99, all of us do it. And I've been impressed with the social responsibility that I've seen now across the nation in college campuses, institutes of higher learning. Boston, less than 1% of the students are infected. And as I said, in Wisconsin, less than 2%. Here, you're in South Carolina, your students are not where your epidemic is. And they have, since many of them live off campus, they have the ability to affect the environment in the community as we try to get this virus transmission under control, one community at a time.
Thank you.
Thank you, Dr. Redfield. I know you all are on a tight schedule. Do you have time for more questions? Or I don't want you to miss your flight.
This is my boss. They don't, one problem being the director of CDC, they never let me travel by myself, I mean, I would love to miss a lot of airplanes, okay? I'm sure the governor would too, but they always put somebody that makes these decisions. If she's going to give me one more question, she will, but she says I have to answer it shortly. I mean, short answer.
Dr. Redfield, thank you for coming to South Carolina. Governor, we were talking yesterday, and you mentioned one of the challenges we're facing right now is testing fatigue. But Dr. Redfield, what can South Carolina and other states do to make sure that the public takes advantage of the testing options we have here in South Carolina? We avoid this testing fatigue that is very important for us to kind of fight and make sure we have a good idea of how everything is spreading in the state.
Yeah, it's a critical question. And one of the most critical pieces of this is, and you've got great leadership here in the state of South Carolina, your public health leadership and obviously your civic leadership. Testing is a critical part of our ability to respond and contain this virus. It's remarkable now that not long ago we could maybe do 10,000 tests a day. Now we can do over 3 million a day in the nation. And you said the real issue is testing fatigue, or I will say the issue, and we've talked a lot about it today, what's the strategic use of testing to recognize the asymptomatic infection? Because, I wish I was young as you again, but I don't think that's going to happen. But the truth is, where this epidemic is being transmitted is people now between the age of 12 and 35, right? And really, particularly between the age of 12 and 25. So how do you get, what we call appropriate surveillance testing? Some universities have done it by doing regular testing of students. This is a critical piece. It's a tool. And I think recognizing that testing is an important part of the public health response. And with testing, there should be a public health action. It's not just you get tested and there's no public health action. And this is why it's so important to engage with the public health community. But I think reminding people that it's an important tool and that this pandemic is not static. You can basically see it can move so quick, as I think your university recognized last spring. And so setting up the proper surveillance, using testing, figuring out the best way to do community surveillance, learning how to use strategic testing where you may even test an entire group that has shown an increased cluster that might be more efficient than the traditional case contact tracing. In some areas it may be just more effective to go into that area and just test everybody and find out where the infection is circulating so we can shut it down. Obviously, I think we're going to see a wide acceptance of testing as it's used to open up long-term care facilities, assisted living facilities. I think, so it's a powerful weapon, just like this mask, but it needs to be used strategically, thoughtfully, and it needs to be linked to a public health action when it's used.
Thank you for coming to South Carolina, Dr. Redfield, and we hope you all have a very safe and good flight.
Well, thank you all for it, and again, I just want to once again thank the governor, not just for the ability to be here, but for his leadership, for the state and the example that this state continues to set. I also want to thank the public health leaders here that I've had the privilege, and I think I've known Dr. Bell for a long time in our HIV history over the years. I also want to thank you for the leadership that this state is providing as one of the 7 states that the President put in his initiative to bring an end to the HIV epidemic. This is not an aspirational goal. It was a very important thing for me personally, having spent my life in it. I'm proud the President made it a priority. It's not an aspirational goal. It's something that's going to get done. And you all are one of the 7 states in the nation that has been given that opportunity to lead the path, along with 50 additional counties where over half of the HIV infection in the nation, it's hard to believe, half of the HIV infection in the nation occurred in just 50 counties, and this nation has well over 3,000. And then, of course, if you look at the transmission in the rural communities, that transmission was disproportionately in 7 southern states, of which South Carolina is one. So I would be remiss if I didn't put a second push for us to stay vigilant. I hope I can come back to South Carolina in about 8 years. I'll be in private life then. Maybe I'll visit the beaches of Charleston once again and be able to see that you all have accomplished the goal to basically bring an end to new HIV infections in your state. So thank you very much.